Hi, I'm Kimberly Allen Atkins. I'm in Liberty University Online. This is for class 491 capstone, and I am a senior. I interviewed Lilith Allen. She is a graduate student assistant in psychological testing in a lab. Her degree is a bachelor's in neuroscience, chemistry, and sociology. She's currently in school in a master's program for prep for medical school, which she will start in 2026 as a neurology student. All right, so those are her credentials. So I asked her, what um, do you find fulfilling about the work that you do? And she started off by American culture um, is fixated with labels and symptoms and quick fix solutions. Um, and the mental health field is no different. Uh, she said that the lab that she works in, they screen for personality disorders, IQ levels, ADHD, and mental health concerns. She said people want answers. They want the answers fast and they want the answers to be final. But she said that testing isn't about diagnosis and about numbers. It's about understanding who the whole person is. And her job, um, she said her job sits in the space between the truth and the test scores that she produces. Uh, she helps administer uh, test score assessments like WAIS for IQ and Connors for ADHD, and also the Big Five measures for personality. Her work is technical, but she also keeps the humanity in testing. She said that she tracks behaviors during testings. She looks for subtleties in behavior such as shifting, sighing, hesitation to answer questions, eye contact, hand movement, tapping, just little nuances in behaviors like that, that she tracks all those during an assessment and a psychological evaluation. Um, and then she translates this into clinical tools, into real life understanding of what's going on with this person. I asked her, what fulfills you in this field? And she said what fulfills her is when somebody finally understands what's going on with them, and that it's not chalked up to them being stupid or them being lazy or failure to thrive or just having, just falling into the categories of what their teacher said they're a bad kid, or their parents say they're bad, or they're lazy, or they don't do this and they don't do that. And she says she actually gives an definition to what is going on with people, and people are extremely happy that they are not the lazy dumb person that people have labeled them throughout their life, and that what they're actually experiencing is ADHD, or severe depression, or different things like that, is what she's saying. And she says she enjoys giving people closure and a name to what's been going on with them, besides all the negativity that they received as a person that really was out of their control. So she said that fulfills her a lot in her job. Let's see. She said it isn't just data when we're dealing with people. We're also dealing with somebody's dignity. She said in her job, she gives people more than a label, more than a diagnosis. She also likes to give them direction to be the best person that they possibly can be in the circumstances that they are in. The challenges in her job is that her job is extremely heavy. It is highly emotional, and the burnout rate is very high, and that she stresses that self-care is a must in the psychology world, and it should be a priority for anybody that seeks this field as a profession. She said that she hikes, she jogs, she knits, um, she talks and socializes, and this gives her a release from the heavy weight of her job. And not only is her job heavy, but she said that um, the precision of her job, you know, making sure that she's using the right tools for the right diagnosis and the right type of data that she needs input is critical, because one error in scoring, one missed input, one miscue, and you risk misrepresenting someone's whole story. You risk somebody not being able to get the help that they need, such as a student who needs a IEP, RTI, a child they may qualify for federal assistance because they have some type of disorder. Just one wrong statistic, um, a data input could change a whole world for somebody in a negative way. So it's extremely important to be due diligent on your tools and inputting the correct data and using the right tools and measurements to measure that data, so you can help somebody instead of hamper them in their life. She said the tension is real and it's always constant. She said what concerns her most and what is the challenges is that she's very uh, proactive on her tools, her measurements, and her data, that she's very hyper, I guess, fixated on that to make sure that what she's doing is correct and that the person will receive the help that they need. For growth, she's still currently in school. She will be attending medical school. She works in a psychological lab. She assists in assessments and diagnosis. She helps with scoring. So her job and her education is what her growth is. But she also reads journal articles, books on psychology, books on testing, and books on personality, which is, she said, is her favorite personality books and things like that, fiction and nonfiction. Um, so those are the things that she does. She said, what would she suggest to a person getting into this field? She said the first thing she would do with person getting into this field is that you must get into the trenches. You must know your job. And she said by doing that, you should go to places where your field is at. So job shadowing. When you get there, ask questions. Be curious, seek knowledge on your own, are things that she said you should do. The second thing you should do is learn how to use diagnostics tools and learn what tools that you need to use in the field is very, very important. Learn about psychometrics, reliability, and validity. Um, because if you can't trust your tool, then you can't trust your results. And third, she said, be silent. She said, silent is one of the best things you can do in psychology. Listen more than you speak. Don't rush to conclusions um, when you're starting out. Um, she said, it's not about being the smartest, loudest person in the room. It's about being the most attentive, the most empathetic, and the person who asks the most questions, who get the best answers, who find the best solutions, is what it's about. And she said, know your ethics, um, practice confidentiality now, um, because a compromise, by convenience could be a lot of problems. Um, she said, protect your client's privacy and their dignity is the utmost of importance of being in this field. And she said, don't lose yourself in your work. Practice self-care. Um, the job is important, but the person who's doing the job is important as well. And so you can't lose focus in that, because if you do, you will not be as impactful as you could be. And you yourself, she said, would actually probably will need counseling. So she said, protect yourself and your mental health. And so what did I learn about this? What I learned about it is that I do not want to get into the diagnostic and assessment part of psychology. It's not for me. I am not a math girl. I have no desire. But I respect the people that's in this field, because without them doing the diagnostics, doing the testing, using these tools to fish out what is wrong with people, it we would not be able to be um, as efficient in our job as we are without the help of people who do psychological assessment. So I thank them greatly, and I'm very appreciative of their job. It's just, however, not for me. I know this job is very detail oriented, math heavy, And most of all, you have to have empathy. You have to treat the entire person, and you have to see them as a person and not a diagnosis. So these are the things that I learned, and thank you. I appreciate having the opportunity to expand my education and my knowledge in fields that I would never consider, but I appreciate it, and blessings to all.